demonstration, I'm going to show you how to perform cytology of the ear. First of all, here's my supplies. I first of all have a clean slide. I have saline to moisten my cotton tip applicator or Q-tip. And then I also have a Kim wipe to go ahead and make sure that my glass slide is nice and clean. So first I'm going to go ahead and clean my slide. And I'm going to moisten my applicator. And then I'm going to go in and I'm going to clean. I'm going to go ahead and get some samples from his ear. I want to make sure not to get too deep so we don't harm him, but I do want to get a good sample. And then I'm going to take my slide, my sample, and I'm just going to push it across in small streaks to go ahead and get a good sample. And then I'm going to go ahead and air dry this and apply a quick flame to the slide to go ahead and affix the cells to the microscope slide so when we dip them, they remain on the slide itself. Now that the ear cytology has dried properly and has been fixated to the slide, I'm going to go ahead and put it through our Diff Quick regimen. So first of all, I'm going to put it in the fixative. So first of all, I'm going to put it in the fixative. I'm just going to put off the excess. Now I'm going to put it in the eosin stain. And it's going to be for about 1 second. 10 different dips in each solution. Excess. Now for the last one, in the methylene blue stain. Now after this is complete, I'm going to go over to the sink and rinse off the methylene blue stain. Now I'm going to rinse off the methylene blue stain, just as we did with the ground stain. We're just wiping off the excess. And then I'm going to allow this to dry, and then I will put this underneath the microscope to see what kind of cells that we have. Once my slide has been thoroughly dried from its washing of its methylene blue, I'm going to go ahead and put it in its microscope and see what we see. I'm going to go ahead and put it on the stage, and I'm going to start off with power 10, and I'm going to go from 1040 to 100 and slowly amplify what is seen on here. So I'm going to, the microscope's already on. And I'm just fine tuning each stage. And then the last one. So essentially what I see is just some epithelial cells. There is a little bit of a yeast infection in here, but I will show you pictures of examples of the cells that I do see on this microscope slide. First of all, I'll go ahead and go over the different types of bacteria that can be found within our patient's ears. So we can first differentiate what type of bacteria it is based on what color stain that the bacteria adhere to, what color it actually comes out to be. If it's a gram-negative bacteria, it is going to be red in color. If it's a gram-positive bacteria, it's going to take on the methylene blue stain, so it's going to be blue in color. The next is the different shapes that we'll see in bacteria. So the cocci are round, the bacilli are rod-shaped. Then we can have different variations in how they're grouped together. So for the cocci, you can actually have diplococci, where it has two together, or you could have different chains. We can also find in our samples themselves, we can actually find yeast, which, well, actually this right here, the kind of arrow-shaped, kind of angular cells here are epithelial cells. And then you can also find yeast in our samples as well. In a normal ear cytology, we are going to have a little bit of a combination. We can have a combination of different types of cells. Usually if we have something that is more bacterial in nature, which these samples that I looked at today were not, they didn't have any bacteria in there, but you can see, any neutrophils, but you can see different types of immune-mediated cells within your samples. In our ear samples, we can also find not only bacteria and epithelial cells, but we can also find yeast as well. So yeast is just something that you'll be able to see within a patient's ears. It'll be a black, oily substance in the ears. And we can also see mites as well. So you'll definitely see that more in cats. You can, but it's just a bloody, grainy substance found in the ears itself. But when you look under the ear cytology, you can see the mites if they are present in the samples, as well as you can see the mite versus whether it's in their egg stage as well.